It's not just like, oh, they're looking at my patient chart. It's they're using that as a diagnostic tool in a way that previously it seems like there wasn't such a reliance on.
Oh, it's completely dystopic because you could say, well, at least I have the facade of a human, being interacting with me. And the AI interaction is just the opposite of what Dr. Oz says. I mean, I have to agree, taking him seriously is very difficult.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up.
Hey, it's Ashley with Status Coup, and we are going to be talking today about the possible tariffs on big pharma and what that might mean for working people. I am really excited to be joined today by Michael Lighty, a healthcare fellow at the Sanders Institute and a prominent advocate for Medicare for All, and he is going to be walking us through all of this. So I just want to set the stage a little bit before we get going. Currently, there are no tariffs on imported pharmaceuticals in their completed state. So if your medication is ready to be taken at time of import, there would be no tariff, but active ingredients might be subject to tariffs. And a lot of our imported medications come from India, China, and Europe. So on this, a BBC article from April 9th said, speaking at a fundraiser dinner for his Republican Party on Tuesday, Trump said, "We're going to be announcing very shortly a major tariff on pharmaceuticals. And when they hear that, they will leave China." He also told reporters on board his Air Force One plane last week that pharma tariffs would arrive, quote, "at a level you haven't really seen before," saying these would be announced in the near future. So aside from what all of this means for global trade, if these tariffs are implemented, and I'm going to say that is a big if at this point, especially now that, aside from China, which still has a 145% tariff, a lot of these tariffs, the other tariffs have been rolled back to 10%. What might this mean for working people? What does it mean for those of us who rely on medications that might be imported, especially lower cost generic medications? What does this mean if you have to go to the hospital or the doctor's office for some kind of treatment? How could these possible tariffs on big pharma affect our lives? So, Michael, what are your thoughts on all of this?
Well, thank you so much, Ashley. It's great to be here with you.
Of
I,
course.
I mean, the thought is this is another sign of Trump's, volatile and highly personal approach to policymaking. I mean, it's all about him, right? And so we don't really know exactly what kind of tariffs are going to be applied. And we don't it's very difficult to anticipate the consequences other than the fact that they're very unlikely to be what he says they are. Now, the potential for negative consequences, of course, is quite high, particularly because, as you mentioned, generic manufacturers have very small profit margins, and the kinds of labor costs that they depend upon, sadly, are just not ones that would be viable in the U.S. The kinds of drugs that are manufactured here, of course, are brand name drugs and, many cases, the higher cost pharmaceuticals. So I think the consequences potentially for access and cost to American consumers are quite grave. And if you look at, just to compare those labor costs, you take a scale, say, of what a labor cost in the U.S. is, say 100, just to choose a number. In China, it's 10, right?
Wow.
And it could be lower in India, could be 8 in India. So this gives you a sense that these plants are not just going to relocate here. It's also true that the free trade regime under the World Trade Organization exempted pharmaceuticals from tariffs for a reason. And that was, of course, to ensure access. So if you now all of a sudden slap tariffs on, and it is true, as you said, that raw materials may be subject to tariff, but even apart from that, Chinese pharmaceuticals are currently subject to a 20% tariff, though exempted from the rest of the higher tariff. So we're probably already going to see a ripple effect there. I think in the short term, manufacturing is not going to come back to the U.S. I mean, these pharmaceuticals, Pfizer's got 30% of its manufacturing capacity here. They might expand that because they've got some existing plants. Where manufacturers have existing plants, yeah, there'll be more. But much more likely is that the generic manufacturers will be slapped with a tariff, which they'll have to pass on to consumers, which means either the drug becomes unaffordable or they stop manufacturing because they simply can't handle in their business model those increased costs. If those drugs stop, then you're moved to a brand name drug, much more expensive, that your insurance may or may not cover, that you may be stuck with a very high copay in order to get. And all of a sudden, the ripple effect is, hey, we're not making this drug in the US and I can't get it.
That all sounds awful. What what do you think the likelihood is that we will actually end up with some of these tariffs? It kind of seems, or I'm sorry, these tariffs on big pharma, because I would guess that the industry does not want this and has a very present lobbying arm. So, what do you think the likelihood is that we actually wind up in this situation?
Ah, yes. I don't even know what it is. The $5 billion question. I mean, it's. I actually think that we're very likely to get some tariffs applied here, because, again, I started with the idea that this is a personal issue for the president. He actually believes that tariffs are a good thing. He's not just, spouting this, the most beautiful word, tariffs. He really does believe that tariffs are somehow a magic bullet that is going to restore manufacturing. And there's a whole ethos around manufacturing is good and service jobs are wimpy that it also kind of is in the background here that kind of permeates this whole debate. But the chances of him doing something in the belief that, just as he said, the companies will come running back to America, I think that's what he believes. And the only reason he backed off on these, this recent set of tariffs is because the market reaction was so negative. So clearly, here's a guy who wants to put it out there, say what he's going to do, maybe even apply it, and then see if it can stick. And that seems to me the model that we're facing in this case as well.
Yeah, for sure. And, as you're saying, these tariffs were rolled back because the abject chaos that they caused for the markets. This in particular seems like a really awful place to have that kind of chaos, because I would guess that there would be questions of a sort of immediate effect on working people and those of us who need to buy medication, which is a lot of people every day in this country.
Right. We're not talking about a car, a purchase that you might be able to defer, right? We're not even talking about, a new shirt that is a lot more expensive from China. We're talking about life and death medications, or medications that treatment of chronic disease, which is most, for most people, they need every day, right, in order just to maintain that kind of health and prevent the flare-ups that chronic diseases cause. So you're absolutely right, Ashley. This is very serious stuff. And that's why pharmaceuticals were treated differently, even under a highly free trade regime, as we used to have, really prior to, President Trump. So I think that the implications for doctors, what they prescribe, the implication for patients, what they can get access to, the implication for the whole supply chain, which is pretty problematic in many other respects, obviously. But pharmacy benefit managers, who play a very problematic role in that supply chain, are going to have some very tough choices to make, because, of course, they've designed their whole business model on a set of drugs being available, right? What they call their formularies. And if all of a sudden these generic drugs are no longer manufactured and no longer available for their formularies. And they've got contracts and they've got all sorts of pricing and delivery relationships based on those contracts. And all of a sudden they're gone. That's going to be hugely disruptive to the healthcare people need.
Absolutely. And we've talked so a little bit about manufacturing, and we know that that is, an industry where there is a push to replace workers with AI, with robotics. Um, and it's not just within that area. So I want to talk a little bit about Dr. Oz, who I kind of hate having to take seriously as someone with any kind of political influence and power, but he is now confirmed by the Senate to lead the Centers for Medicare and Medicaid. And according to a piece from Wired, so that's what's up on the screen, Dr. Oz apparently spent much of his first all staff meeting on Monday, so this past Monday, promoting the use of artificial intelligence at the agency and praising Robert F. Kennedy Jr.'s Make America Healthy Again initiative. Sources have told Wire. During the meeting, Dr. Oz discussed possibly prioritizing AI avatars over frontline healthcare workers. Dr. Oz claimed that if a patient went to a doctor for a diabetes diagnosis, it would be $100 per hour, while an appointment with an AI avatar would cost considerably less at just $2 an hour. Oz also claimed that patients have rated the care they've received from an AI avatar as equal to or better than a human doctor. Research suggests that patients are actually more skeptical of medical advice given by AI. Makes sense. Because of technologies like machine learning and AI, Oz claimed that it is now possible to scale good ideas in an affordable and fast way. And in a Guardian piece, Dr. Oz also said, and this is a quote, "I think it is our patriotic duty to be healthy." He told Republican Senator Todd Young of Indiana, "First of all, it feels a heck of a lot better, but it also costs a lot of money to take care of sick people who are sick because of lifestyle choices." Um, so as a patient who does have several autoimmune diseases, I'm one of those people that you mentioned that rely on, daily medications to manage chronic disease. And I, in general, am just a human being who cares about the well-being of other human beings. This is kind of fucking terrifying. I don't really want to be treated by AI, and the thought of just like permanently removing healthcare workers from the medical chain is kind of insane to me. And this obviously has a lot of repercussions when healthcare, as you've advocated and have spoken about publicly, is irrevocably tied to employment. That is obviously not going to have good results for people. And we just ran a story on Status Coup about AI coming for our jobs during a time where so many workers are being laid off. And it just feels like this is one of the worst industries to be replacing human workers in. So, Michael, what are your thoughts on this? The sort of replacement of actual healthcare workers with AI?
Well, Ashley, it's a culmination of a trend that accelerated under COVID, which is what we had then before AI was telehealth, right? So you no longer had to go physically to the doctor's office. In some cases, obviously for good reason, you could simply get on a video screen and access your provider. And that, prior to that, there was a whole trend to lessen the use of highly skilled caregivers in hospital settings because they were so expensive. And then to divide the task kind of on an industrial model, divide the task so that lesser paid workers could do some of the routine tasks of caregiving, reserving a role for, say, registered nurses over medical assistants, right, to those more kind of high need, more specialized tasks in a hospital setting. So there's a whole tail to this, right? Which is essentially increasingly removing the person most capable of giving care, honestly, because just they're educated to do it. Everyone in the team has a role, but there's a reason registered nurses, right, are the ones who are doing your IV, for example. And so AI is just the kind of on steroids a culmination of that trend. And it was reserved primarily, these other trends, to nursing. Now, of course, it's coming for doctors, right? And medical providers. And doctors have been somewhat immune from this until telehealth. And now they're looking at a direct labor replacement model, which is inevitable, frankly, if you take this whole market ethos as the driving force in healthcare. Obviously, one of the key market inputs is labor costs, and they will do everything they can to reduce labor costs, including taking care out of the hospital and putting in a clinic and a whole array of other care delivery strategies. So AI is in that context. AI specifically is a disaster, because the whole point of a doctor-patient interaction is to understand the particular needs of that patient. And of course, the other trend in healthcare has been to actually provide care on a population model. In other words, using population-based studies and protocols to design treatment programs based upon what the usual patient is, right? And that kind of data-driven approach increasingly drives medical interactions. So when you go to the doctor and they're looking at the computer screen, they're looking at all these, essentially algorithmic protocols, right? And population-based studies about what the most effective treatment is. Oh, well, it's just one more step to say, well, we don't need the doctor delivering that right. Data-based diagnosis and treatment plan. We'll just have a machine do it, because, hey, we were relying upon this kind of data anyway to tell us what to do, to tell doctors what to do, and now we'll just have the machine tell the patient. So you have to understand that this is not out of nowhere. It's a direct result of a long-term approach to caregiving that is completely disruptive and contrary to what caregiving actually is.
That all makes a lot of sense. That makes a lot of sense. I feel like, over the years, I've noticed myself that if I do go to the doctors, there is far more time spent like looking at things on a computer screen that are kind of being explained to me, and everything that you've said there kind of puts that into context. It's not just like, oh, they're looking at my patient chart. It's they're using that as a diagnostic tool in a way that previously it seems like there wasn't such a reliance on. So that's really interesting in a kind of awful dystopic way.
It's completely dystopic, because you could say, well, at least I had the facade of a human, being interacting with me, even though they were, the inputs were coming from this data. So the AI interaction is just the opposite of what Dr. Oz says. I mean, I have to agree, taking him seriously is very difficult. So yes, what he says is wrong. People don't like interacting with machines. They, the telehealth experience they like because they don't have to leave home, but that's still dealing with a person, right? So there's real concern. First of all, the essence of the caregiving relationship is hands-on. Understanding the patient's narrative, developing a treatment program that is specific to their situation and diagnosis and needs. And though all those aspects of it are not available to an AI, whether this happens or not, will depend a lot on whether hospitals, medical groups, really do value physicians, because the physicians are not going to take kindly to this. And physicians still do have a lot of power, we say market power, right? And I do think that increasingly the whole character of the healthcare system and the efforts by the industry on a business model to transform them increasingly impact doctors in an exponentially more difficult for them and much more impactful way than they ever have. And so doctors are on the front lines of these changes in healthcare, even more so than they've ever been. And this AI is the worst and most obvious example of that. If doctors don't stand up and push back and defend their profession, even after all the erosion that's occurred, they will lose it. And it will become a very narrow, they'll have a much more narrow role in the healthcare system unless they stand up and defend themselves.
Absolutely. Yeah, I couldn't agree more with what you've said. And again, just to kind of underscore, I have a lot of experience dealing with exactly this kind of stuff that you've mentioned. And it's only because I've had a series of really wonderful doctors that I've been able to, get treatment for autoimmune diseases, things of that nature. And if I had been subject entirely to, being treated by an AI avatar, there's no chance. There's no chance that I would have been diagnosed or been able to get any of the treatments that I've needed. So this is, again, very, very frankly scary for a lot of people. And I know you've mentioned this a little bit. You talked about, what doctors should be doing in this moment. So, for you as an advocate for humane healthcare policy, which means decoupling healthcare from employment, what can working people do in this moment where, again, workers are being laid off, and losing their health care, workers are being laid off, losing their health care, and being replaced with AI? How do we all move forward from here? What can we do? Where should our attention be?
Well, to me, this AI incursion into the doctor's office just represents how serious the threat of AI is to jobs and to a stable society and to the future of workers and the future of work, obviously. So there is, first of all, the principle of solidarity, that this, we thought, oh, well, AI will just, hit manufacturing jobs. So, or AI will take over call centers, right? So it wasn't just a manufacturing versus service, but there was some sense that these were not high level jobs. You start talking about physicians, that's high level work. So we have to create that sense of solidarity across the job spectrum, number one. Number two, we have to understand that as much as we demand a system transformation, taking healthcare off the bargaining table, severing its relationship to employment is important for the system as a whole, right, to save money and guarantee healthcare to all of us. It's also important to individual workers, because if your boss likes AI and think this is a great idea, guess what? They're going to contract with providers who use AI. In the doctor's office, and you're going to be subject to whatever kind of care that they think is appropriate. And for many, many workers in big companies, those jobs are self-insured by their employer. In other words, the employer doesn't use an insurance company to take on the risk. They're self-insured. They pay an insurance company to administer claims, but they make a lot of decisions about which providers are in their network, in their coverage plan. And so you're going to be looking at, I think, particularly in the tech sector, who are all gung-ho about this, we're totally down with, the AI doctor office. And you're not going to have a choice. So that's the other issue. And then finally, there does need to be a real fight back based on that solidarity. And again, as you said, Ashley, healthcare is so personal that this kind of AI incursion is going to resonate. So let us build on that. Let us build on the threat to jobs overall and actually demand that elected officials stop it. That these, we always assume, oh, companies can just do what they want. It's the free market. It's up to them. It's like, no, that's not true. That's how the Trump administration would probably like the economy to work. But until it does, and let's hope we never get to that point of just complete deregulation, which seems to be their objective, let's demand a way of working that actually meets the needs of workers in their communities and not just devastate our workforce, not just destroy livelihoods, and not just completely disrupt our relationship, even in healthcare, to our own providers, and demand real limits and prohibitions on the use of AI. Because the other insidious aspect of this, of course, is where do they get all that data to drive the AI interaction? Those are our private medical records. That's
a real point.
Right. That's our health data about ourselves. And so if they were to actually pursue this, it would be a massive invasion of privacy.
Absolutely. Yeah, absolutely. That is all such great information and so harrowing. I guess I would ask, is there anything else that you would want to add on, the impact of possible tariffs on big pharma, on AI, on Medicare for all, and any of that?
I would add that the part of the reason that we demand Medicare for all is because we want a transformed healthcare system and not just take on different aspects of the system or try to just reform, pieces of it, but to really transform it. And there's quite a bit of support for that transformation. People really do experience the healthcare system as fundamentally flawed, right, and not serving their needs. So let's take this opportunity when there are assaults on all fronts. They're going to decimate Medicaid if they have their way, right? Dr. Oz is going to privatize Medicare, right, through this so-called Medicare Advantage program. Right. They're going to institute AI in the doctor's office. They're going to invade our personal medical records in order to fuel their new industry business model. So let us understand that transforming the healthcare system is the only way to address all of these issues, all of these assaults on what we need, what kind of healthcare we need and are going to get. And Medicare for all is not simply a way to publicly finance healthcare. It's a way to create a democratically run healthcare system in the interest of patients that allows providers to practice as they were clinically trained, to exercise their professional clinical judgment. That's what Medicare, it's never been a government-run system. It's been a provider-run system. It's been a truly patient-centric system, a democratic system where people are able to say, this is the kind of healthcare system that I want. This is the particular kind of healthcare that I need, and demand that the system provide it. In the current private industry model, we can't make those demands. Employers are determining it. Obviously, industry interests are determining it. And when it comes to pharmaceuticals, this is another example of why a market model is so subject, right, to trade, another market mechanism, right, that it is not appropriate for it to be exclusively a profit-driven system in pharmaceuticals, that you have to have, as much as possible, publicly financed and publicly administered pharmaceutical benefits. And if you want to ensure that people are going to make a living wage manufacturing pharmaceuticals, well, then make that demand specifically, create an industry model that does publicly manufacture medicine here in this country and in other countries, like California is trying to do with insulin. Those are the different approaches. You don't need tariffs. Tariffs are just an intervention in a very problematic supply chain and industry market, right? What we really need is a wholesale change, again, in pharmaceutical policy and the ability of public entities to produce those medicines to the greatest extent possible, since we're financing the research behind them anyway.
Yeah, absolutely. And just to like yes and you a little bit, that the research that we do at private institutions at these universities that are, under attack by the current administration, we've been told that part of the reason that, we have this private healthcare model in the US is because we use that money to fund this research that will benefit all of us, and that's just kind of part of the hypocrisy of everything that's going on right now.
Yeah. And excuse me, their goal is to privatize everything. And we have to be very clear about that. And our goal has to be, no, these are essential goods, services that people depend upon for their very lives. And we need to actually make them public and democratic, small d democratic, and not let industry just determine it and not give them free rein to destroy our jobs and jeopardize our health.
Absolutely. That was all so well said and so informative. I would ask, are there any initiatives that you would like to draw people's attention to? And if people want to follow what you're up to, where can we find you?
Well, thanks. Well, the federal Medicare for All bill, sponsored by Representative Jayapal and Senator Sanders, is being reintroduced at the end of the month. And so people need to contact their representatives and demand that they support this Medicare for All legislation. And it's if Democratic elected officials don't understand the importance of that, then we have to really be militant in arguing for it. And it's essential to resist the Trump agenda, and it's also essential to have an alternative agenda. And Medicare for All is at the top of that agenda. I can be reached through healthycalifornia.org. It's statewide healthy. It's healthyca.org, statewide single payer coalition in California. And also, I would urge people to join the Care Over Cost campaign, which is an effort to stop the denials of care by the commercial insurance companies.
That is great. Again, thank you so much for walking us through all of that. That was all really wonderful, and we really appreciate your insight. Thank you to everyone who is watching. Please stay tuned for more news that matters to working people with Status Coup, and we will see you soon. Bye. Thank you again, Michael.
Thank you.